how do you actually educate the patients when it comes to what to expect after the transplant? So, in terms of some of the techniques and things that you teach them operatively. So, when they're in the waiting period, then anxiety and other things are rife at that stage, and still you need to prepare them. So, how do you kind of approach that?
Yeah, look, it's really important. And giving the patient the information beforehand before they go in is really, really useful. So, a lot of us done one-on-one. We, for example, also run groups here that are specific for pre-transplant patients. So they get some education within the group environment as well. But it's really about outlining to them, what the process actually involves for transplant, and going into some of the details regarding the surgical incisions and the drains and that early post-op period. So they're fully informed of what to expect as they go forwards. But then also then framing that, well, what can they control beforehand to give them some sense of control over the whole process? And, their physical fitness is one of the few things that they really do have ownership over. And so we go through talking about, what exercises are best for them in terms of transplant setting. So can they maintain their walking as
Mhm.
best as possible, for example? Looking at their lower limb strength in particular, because, we lose a lot of strength in those early days after a lung transplant. And so can we maximize their leg strength beforehand as much as absolutely possible? Thinking about their posture, can they optimize their posture? We know it's easy to develop some sort of poor posture habits, if you like, pre-transplant to do with those lungs. And so trying to work on that good posture beforehand, which will help breathing now, but also sets them up well for post-operatively. And again, looking at their upper limb strength as well. So it's really just about that education about why it's
Mhm.
so important. We know it's hard work, but why it's important. And then going through individually, what is the right pace, intensity, duration for them for each individual person.